There are a lot of things that I want you to get out of this class today, but certainly my primary 3 objectives for you are that by the end of this course, you'll be able to describe characteristics of SM and your role as a speech-language pathologist in assessing and treating SM. You'll also be able to plan and carry out an effective assessment protocol so you can determine your students' strengths and specific areas of need. And based on that information, you'll be able to create and implement a really intentional and evidence-based treatment program that's specifically tailored to your students' needs and where they're starting from and where you'd like to get them to. So the diagnostic criteria for selective mutism, there's 5 components to it, and this comes directly from the Diagnostic and Statistical Manual. The first thing is that the student has to have a consistent failure to speak in specific situations, despite the fact that they have normal speech in another situation. So like I said before, typically this is they're able to speak normally at home, but they have difficulty at school or in the community. The disturbance has to be interfering, so it's not just something that happens occasionally for the child, it's not something that doesn't have any ramifications, but rather it has to actually impact educational or occupational achievement or their ability to engage in effective social communication. This next one is an important one. The duration of the disturbance has to last at least 1 month, and it has to be beyond the first month of school. So this criteria really helps distinguish between the kids that are kind of our slow to warm up kids who might start school at kindergarten and are very quiet, are very hesitant to engage, but over time they're able to warm up, and within a month or 2 they're able to respond pretty normally. These kids with selective mutism, they don't have that warm-up period. They certainly may become more comfortable over the first month or 2 of school, but after that time period, there's still significant difficulties in terms of social communication and just meeting typical age-appropriate expectations. So it's really important to look at, is the selective mutism lasting more than a month, and is it lasting beyond that first month of school? So we've spent some time talking about what is selective mutism, who is involved in treating and working with kids with selective mutism. Now we're going to move into what you as a speech pathologist are going to be doing with children with selective mutism. And we're going to start by talking about what does it look like to assess a child with selective mutism. As you can imagine, there are certainly some inherent difficulties to assessing a child who has difficulty speaking, especially a child who has difficulty speaking to new people that they're not comfortable with. So certainly working with kids with selective mutism in terms of assessment does require some creativity, but I have some strategies here that hopefully will be helpful to you as you work through the assessment process with them. It's super important to have a strong case history and really get important information from an interview. So typically you're not going to be able to interview the child themselves. They usually won't be able to answer most of these questions to you, especially the first couple of times you're meeting them, but you can usually get the kind of information you're looking for when you're talking to their parents. So some good ideas for case history questions to ask can include the ones that are listed on this page. There is a great resource out there that I want to make sure all of you are aware of. It's free, which I think is fantastic, and it's called the Selective Mutism University. I have the link there for you, but you can also find it just by Googling Selective Mutism University. And once you create a free account there, you can access tons of resources for the treatment of SM. It's put together by Stephen Kurtz and the Kurtz Psychology Corporation. They have put together a series of videos that are great for parents, teachers, therapists, anyone who's going to be working with a student for selective mutism. So I have some of those videos here for you, and I just want to show you some samples of what's available there. And I think they're also really great because they really start to pull together some of these skills that we're talking about. And I think it's really helpful not just to talk about what it looks like and what it sounds like, but to be able to see this is what it looks like when it all comes together when you're actually working with a child. The Communication Bridge makes a lot of great contributions to our understanding of selective mutism. One thing that it does really well is it helps parents and clinicians understand the role of nonverbal and transitional communication rather than just jumping from being frozen to talking. So sometimes I think when we meet kids with selective mutism and they're in that frozen stage, our goal is we want to get them to that verbal stage. We want to get them talking. And I think it can be easy to skip over those intermediary stages and realize that kids need to go through a variety of these stages for different amounts of time before they get to verbalizations. It's not something that's going to change quickly with one great session or with a couple weeks of sessions. Contingency management is really important, and it involves using a positive reinforcement or reward system to really aid in shaping behavior, and it helps to make social interactions more rewarding and more positive focused rather than based on avoidance or negative reinforcement. And so this is where I think it's important to stop for a minute and talk about bribery, because a lot of people hear the concept of, a rewards chart and think, but that's bribery, but the child's going to be extrinsically motivated. We don't want to facilitate extrinsic motivation. And parents too can really get stuck on this piece of, I don't want to bribe my child to do something. So I think it's really important to distinguish what's the difference between bribery and between getting a reward for something. So bribery is something that happens in the moment out of desperation. It's when a parent or a teacher or a therapist offers something that you didn't really have any intention of offering to the student before, but in that moment of desperation, you're kind of reaching for whatever you can think of that will make the situation better. And whatever you're offering typically doesn't match the situation or the level of effort that the child is required to put forth. It often goes way above and beyond and kind of overshoots what you really need in that situation. By contrast, a reward is something that's decided upon beforehand and agreed upon beforehand by both the parent and the child. And it's something you can remind the child of in the midst of the interaction. So if maybe they're starting to waver a little bit on motivation, you can kind of come back to, remember, we talked about after you practice asking this question, you get to pick out a new toy from the dollar store. And the offered item really matches the level of effort that's required from the child. And another thing I like to propose to parents is we get rewards all the time for doing hard work in our life. So the most typical example of this is going to work. We go to work, we put forth all the effort required to do our work, and in return we get paid a salary. So we are receiving a reward for our hard work. Our kids with SM, practicing these talking skills and these interaction skills is really hard work for them. And so we need to look at a way of providing some type of payment or reward for that really shows we value the hard work that they're doing and that they have earned something for the level of effort that they're putting forth.